In response to the growing concern of open defecation, the federal government of Nigeria, in collaboration with the United Nations Children's Fund (UNICEF), organized a private sector consultation for the Clean Nigeria campaign on Tuesday and Wednesday in Lagos to renew efforts to eliminate open defecation by 2030 in line with the United Nations Sustainable Development Goals.
For the private sector engagement, particularly the UNICEF, the microfinance institutions, and all other meaning institutions that are geared toward improving the lots of our people. We are trying to place an advocacy whereby funds can be generated and full into the wash sector.
But particularly on sanitation, some states have laws that govern water and sanitation in their states. And so for us as private entities to invest in any state, we have to look at the laws that govern investment in that state, but also the laws that govern sanitation in such states. And so this forum is to encourage states at first identify the barriers to entering into some states, but also encourage states to remove these barriers that allow private sector to bring in investment in sanitation space.
According to the Director of Water Quality, Sanitation and Hygiene at the Federal Ministry of Water Resources and Sanitation, Mrs. Elizabeth Ugo, despite efforts to attain an open defecation-free status, there is the need for increased investment, improved infrastructure and stronger partnerships to address these challenges while calling on the private sector to actively support sanitation initiatives.
This partnership that we have with the private sector, they can intervene by providing these toilets either in the public places, either in schools. The provision is what we mean to make up the number. And the government, of course, is not resting on its house. The state is doing their bit, and the federal government will come in at interventions. Already now we have about over 5,000 toilets provided by the federal government all over the country. And so this is how we are also hoping.
UNICEF Nigeria's Chief of Water, Sanitation and Hygiene, WASH, Dr. Jane Bevan, stated that with an estimated 48 million people lacking access to toilets, the government cannot solve this issue alone. Hence the call for a multifaceted approach that includes the private sector.
It's estimated that there are 48 million people without access to toilets, and that means a whole lot of health issues, a whole lot of disease issues, and generally very unsanitary conditions. So it's really important to get everybody on board. Not the government can't do it alone, certainly agencies like UNICEF can't do it alone, but together we can make a big difference. There are 126 open defecation-free LGAs in the whole country, and we need to obviously rapidly improve that coverage. The private sector could really help setting up particularly private public toilets, particularly in urban settings. Lagos is a perfect example. We need more public toilets so that people don't have to resort to open defecation.
Open defecation remains a pressing issue in Nigeria, posing significant challenges to public health and environmental sustainability. By addressing open defecation, Nigeria can significantly reduce the transmission of neglected tropical diseases. In Lagos, for News Central, I'm Bettina Nwelih.